If you suffer from constipation, feel discomfort when going to the bathroom, and your stool feels dry and hard to pass, you clicked on the right video. I'm here to help you and share tips that may improve this today. So make sure to subscribe to the channel so you don't miss any content like this. Mrs. Margaret was 68 years old, retired, a former seamstress, born in Burlington, Vermont, mother of 3, grandmother of 6. She walked into my office on a Monday morning, her face tired, and she said something I will never forget. She told me, almost in a whisper, almost embarrassed, "Doctor, it's been 9 days since I've had a normal bowel movement. I don't even know what normal feels like anymore." 9 days. Think about that for a moment. 9 days with a sluggish gut, a bloated belly, that feeling of carrying a weight that doesn't belong to you. And the worst part? The quiet certainty that this had become her everyday life. I've been a physician for almost 20 years, and one of the stories I hear most often in my office is exactly this one. People who have lost touch with what a healthy gut even feels like. People who have accepted constipation as their fate. And what worries me most in my daily practice is not just the patients who arrive like Mrs. Margaret, but the huge number of people living this way without ever asking for help. Today, I need to share something with you that has changed the way I guide these patients. There is a homemade smoothie made with 3 ingredients you probably have in your kitchen right now that may support your gut in a way most over-the-counter laxatives simply can't. And the effect for many people is not in days, it can show up in hours. Stay with me until the end because I'm going to tell you exactly which 3 ingredients these are, the right proportion to use, and most importantly, the time of day that may make this smoothie work best. And more than that, I'll tell you the mistake that most people make when preparing it, the mistake that takes away nearly all of its potency. But I need to be honest with you before we go any further. The title of this video talks about getting your gut moving in a few hours. And yes, that does happen for many people. I have seen it happen many times in my office. But my commitment to you is medical truth, not sensationalism. This smoothie is not magic. It works because it combines 3 biological mechanisms that act together. And it does not replace proper medical evaluation of chronic constipation. Whenever the problem lasts more than 3 weeks, it is essential that you see a healthcare professional. That principle never changes. With that said, let me explain what is happening inside your gut when it slows down. The human intestine is a highway nearly 25 feet long. Yes, 25 feet. If you stretched out the small intestine and the large intestine of an average adult, it would reach almost the height of a 2-story house. And this highway has a silent, continuous job that goes on 24 hours a day without pause. Pushing, processing, absorbing, eliminating. When this highway gets congested, the entire body feels it. Constipation is not just abdominal discomfort. It can show up as unexplained fatigue, as dull skin, as bad breath, as recurring headaches, as mood swings, even as a weakened immune response. Because a backed up gut may reabsorb compounds that should have been eliminated. And those compounds return to circulation, putting extra strain on the liver, on the kidneys, on the skin. According to data from the American Gastroenterological Association, about 16% of American adults suffer from chronic constipation, roughly 1 in 6. And among women over 60, that number rises to nearly 1 in 3. It is a silent epidemic. Here is what really catches my attention. Most of these people try to solve the problem with stimulant laxatives from the drugstore. And here is the point that almost no one talks about. Continuous use of stimulant laxatives can irritate the intestinal wall, weaken the muscle response over time, and leave the gut sluggish. In other words, the person enters a cycle where they need more and more laxative to get the same effect. It's like a spring that, after being stretched too many times, loses its ability to bounce back. What science has been showing is that the safest and most effective long-term strategy is to retrain the gut with the right kinds of fiber, the right amount of fluids, and natural compounds that gently support peristalsis. And that's exactly what this smoothie may help do. Let me introduce the 3 ingredients now. The first ingredient is ripe papaya, about a generous cup, with the flesh deeply orange. Papaya contains an enzyme called papain, which helps break down proteins and may soothe the intestinal lining. But what matters most is the soluble fiber in the fruit, which absorbs water in the colon and forms a soft gel that helps move the intestinal contents along without harshness. And do you know what impresses me most about papaya? A study published in the World Journal of Gastroenterology found that adults with constipation who consumed papaya regularly for 40 days showed significant improvement in intestinal transit and reduced straining. No major side effects, no dependence, just the fruit. The second ingredient is freshly ground golden flaxseed, 1 heaping tablespoon ground right before use. And pay close attention here, because this is the detail that makes all the difference. Whole flaxseed passes through the gut almost intact. It needs to be ground to release its fiber and its omega-3 fatty acids. Ground fresh, not bought pre-ground, because once ground, it oxidizes within days and loses much of its benefit. Flaxseed is like a sponge that may absorb up to 30 times its weight in water. When it reaches the colon, it hydrates the stool, making it softer and easier to pass. Researchers at the University of Toronto have shown that regular consumption of ground flaxseed is associated with improved transit time in people with functional constipation. And the third ingredient, perhaps the one that helps the smoothie work fastest, is dried prunes. 3 to 4 pitted prunes soaked in warm water for about 30 minutes before use. Prunes have 3 powerful allies: sorbitol, which draws water into the gut, a unique combination of soluble and insoluble fibers, and phenolic compounds that may support the natural contraction of the intestinal muscle. A study published in Alimentary Pharmacology and Therapeutics directly compared the effect of prunes with psyllium, one of the most widely used fibers in the management of constipation, and the result was clear. Prunes perform better in improving stool frequency and consistency. People who eat prunes regularly tend to have an easier time in the bathroom with better formed stools. It's the fruit that acts like a personal trainer for your gut. Now, before we go on and I show you how to combine all this and when to take it, I need to ask you for one small thing. If this content is making sense to you, if you are learning something new about your own body, please tap the like button right now. That simple gesture helps this video reach more people who need this information. And if you haven't subscribed to the channel yet, do that now and turn on notifications. And tell me in the comments which state you are watching from. I love seeing where this community is growing. Back to our topic. How to prepare the smoothie. In a blender, you'll add the cup of ripe papaya, the 3 soaked and pitted prunes, the tablespoon of freshly ground golden flaxseed, and about 7 ounces of filtered water at room temperature. Blend for about 40 seconds until smooth and creamy. Do not strain it. The fiber is an essential part of the formula. Straining is exactly the mistake that takes away most of its power. Do not add sugar. Sugar interferes with peristalsis and feeds the wrong bacteria in the gut. If you absolutely need sweetness, a small teaspoon of raw honey is acceptable, but ideally you want it plain. And the ideal time to drink it is this: on an empty stomach, first thing in the morning, before breakfast. Why? Because the gut has a natural reflex called the gastrocolic reflex. When the stomach receives food or liquid after a full night of fasting, it sends a signal to the colon to start contracting. It is the moment when the intestinal muscles are most responsive. Drinking this smoothie at that time is like pressing a button on the gut's biological clock. Drink it slowly, in small sips, over about 5 to 10 minutes. Then wait 40 minutes to an hour before eating anything else. Throughout the morning, drink at least 20 ounces of water. Water is the fuel that turns fiber into movement. And here is the detail that makes all the difference. The smoothie should be consumed the same day it is prepared, ideally within the first 20 minutes after blending. Ground flaxseed exposed to air quickly loses its fatty acids. Mashed papaya oxidizes. Soaked prunes begin to ferment. Freshness is part of the formula. Let me tell you about Mr. Raymond. 62 years old, a retired long-haul truck driver, born in Tulsa, Oklahoma. He came to my office referred by his cardiologist with a complaint of constipation that had lasted nearly 8 years. He took a laxative almost every day. He had developed grade 2 hemorrhoids, chronic anal pain, and that frustrating sensation of incomplete evacuation that haunted him every morning. When I evaluated him, I saw that he drank less than 30 ounces of water a day, ate very little fruit, and lived on bread and processed cheese on the road. I told him we were going to wean him off the laxative gradually and introduce this smoothie every morning, along with a steady increase in his daily water intake. On the first day, nothing happened. He called me on the second day, a little discouraged. I said, "Trust me, one more day." On the third day, he had a bowel movement in the morning, without pain, without straining, and he sent me a message that said, "Doctor, I had forgotten what this felt like. I thought this was never going to happen for me again." Within 4 weeks, he was going to the bathroom every day, without any laxative. The hemorrhoids improved. The bloating disappeared. And most importantly, he told me something I still keep with me. "Doctor, it feels like something changed inside. I wake up with more energy. My body feels lighter." And that's what happens when the gut starts working again. The whole body feels it. Because gut health is not a small detail. It is one of the foundations of overall well-being. Now pay attention because this smoothie has allies that boost its effect. Hydration above 2 liters of water a day. A daily walk of at least 30 minutes, because physical movement supports peristalsis. Adding other fibers to your meals like oats, chia seeds, leafy greens. And perhaps the most underestimated ally of them all, going to the bathroom at the same time every day, even without urgency. The gut learns routine. It responds to consistent timing. Sitting on the toilet about 20 minutes after breakfast, every day, can train the muscles for the natural reflex. But I also need to give you a few important cautions. This smoothie is not for everyone. People with irritable bowel syndrome, especially the diarrhea predominant type, should avoid it because it may worsen symptoms. People with a latex allergy may have a cross-reaction with papaya. People taking blood thinners should talk to their doctor because flaxseed in large amounts may interact with these medications. And anyone going through an active flare of diverticulitis should wait for the inflammation to settle before consuming a high-fiber blend like this. And here is what hurts me most as a physician. When a patient walks into my office after years of constipation and tells me, "Doctor, I thought this was just part of getting older. I thought it was normal." It is not normal. Accepting life with a sluggish gut is not aging with dignity. It is aging while losing quality of life that you didn't have to lose. Back to Mrs. Margaret. She started the smoothie on a Tuesday. On Wednesday morning, she called me. Her voice sounded different, lighter. She told me, "Doctor, it worked. It was quick. It was painless." And I cried in the bathroom out of relief. I had forgotten what feeling well even felt like. Within 3 months of follow-up, Mrs. Margaret had changed. And not just her gut. She started leaving the house again. She started having lunch with her granddaughters again. She had stopped doing that for years out of fear of needing a bathroom away from home. Now, she said, her body finally listened to her again. Let's recap what we learned today. The smoothie is made with ripe papaya, freshly ground golden flaxseed, and soaked prunes, blended with room temperature water, unstrained and unsweetened. Taken on an empty stomach, first thing in the morning, in small sips, with steady hydration throughout the day. The effects usually appear between the first and the third day for most people. And it works because it combines soluble fiber, insoluble fiber, sorbitol, and digestive enzymes, all acting together. And I want to tell you one more thing before we close. Your gut is not your enemy. It is trying every single day to keep your body clean, balanced, and functioning. When it slows down, it's because something in the routine is missing. Water, fiber, movement, regularity. Health is not found in the pharmacy aisle. It lives in the small habits of the morning, the middle of the day, and the night. Send this video to that mother who is always complaining about constipation, to that friend who quietly takes laxatives every day, to that father who is too embarrassed to talk about it. This information protects quality of life. And in the next video, I'm going to reveal the 5 foods that look healthy, but may be quietly making your gut worse. Number 3 is on the breakfast table of almost every American family, and almost no one suspects it. You won't want to miss it. Take care of your gut. It is the 25-foot highway that carries your health every single day. And when that highway flows, life flows with it.